Hi, I'm Carrie Bevavino from Roaring Fork Equine Medical Center, and I would like to help you better understand equine preventative care and wellness exams. So to start, what is equine preventative care? So equine preventative care is implementing or offering care that's going to reduce the occurrence of significant disease or poor health in your horse. So how does preventative care affect the health and well-being of your horse? So by implementing some of these measures, what you're hopefully doing is reducing the occurrence of disease and or reducing the severity of certain diseases that your horse might be exposed to. That could do anything from calling the vet out to your place, having your horse experience significant time off, or in certain scenarios, even experiencing a life-threatening illness. So what can you expect from a preventative care appointment? So a preventative care appointment provided by myself would first start with a good history on your horse. So I want to know how your horse has been doing. Has your horse been eating well? Have they been a good weight? Have they had a good energy level? Is there anything that you have observed that causes concern? Or is there anything that you specifically would like to investigate in your horse or concerns that you have? So from there, the next thing I move on to is a good physical exam. So as part of my physical exam, I'm looking your horse over from nose to tail, and I'm looking for any subtle abnormalities that could potentially indicate underlying disease that we need to investigate further. And just make sure everything's working well. Make sure the ticker is ticking well, make sure the lungs are working, palpate those legs, make sure everything feels good. From there, the other things that we might do would include something like a dental examination. As we know, horses have kind of these continually erupting teeth that sometimes can get sharp points and or other significant abnormalities that might affect the health of your horse. We might also collect some feces to look for parasites in the feces, because what we now know is this can help to guide us on how frequent your horse needs to be dewormed and with what. Also, the other things that we might talk about are things like equine endocrine diseases. So depending on what your concerns are and what we find on physical exam, there might be an indication that your horse could be affected by one of these equine endocrine diseases. These diseases that I'm speaking of are equine metabolic syndrome, which we can see in horses of really any age, or pars pituitary intermediate dysfunction, which is a condition that typically affects older horses and can have some pretty significant clinical signs that can worsen over time if the disease is not diagnosed and treated. Both those endocrine diseases are usually tested for using a blood test and then sent off to an outside lab. So what are some preventative care practices that you might experience? So to begin, vaccination. And we'll talk a little bit more in depth about this in just a little bit. But that is one really good measure to ensuring that your horse has a less severe reaction to some of the diseases they might be exposed to. From there, deworming. And as I talked about with collecting feces, what we now know is kind of less is a little bit better in most horses. And doing that fecal exam is definitely going to better help guide us on what your horse needs to be dewormed with and how frequently. And it could be as little as 2 times a year. From there, maybe a dental flotation. So depending on what we find on dental examination, how long has it been since the last time your horse has been floated, that might be something that we do. Here at our clinic, we make sure those horses are sedated, and we do use the power dental float to make sure that we have really precise changes in treatment of your horse's teeth. The other thing that we might do as part of this preventative care appointment is a Coggins test. So a Coggins test is not necessarily to prevent disease in your horse, but to prevent disease in horses that are around your horse. So the Coggins test tests for a disease called equine infectious anemia. That's a virus transmitted by flies. Once a horse is infected, they can get pretty sick, and some horses do recover from it, but there's no specific treatment and there's no way to really prevent it, aside from ensuring any horse that is positive is appropriately quarantined as dictated by government officials, because it is a reportable disease. But as most of you guys know, for a Coggins test, you need to get done once a year. It requires a blood draw and then pictures of your horse, so that then you get a form that you're going to carry around that you need to enter most shows and to board at most facilities. So a Coggins test, again, is going to be part of that preventative care appointment. Again, our goal is to protect horses that are around your horse. All right, from there, what vaccinations would your horse need? So it really depends on where your horse is and what your horse is doing. So most horses that are just out there in the world are going to need things to be protected from things that are in the environment. So the mosquito-borne illnesses, such as West Nile virus, as well as Eastern and Western encephalitis, are going to be part of that vaccination protocol. These, again, are those mosquito-borne diseases. Depending on where your horse lives, they might need that once a year or twice a year if you're in Florida or Texas, or some of those climates which mosquitoes are flying around all year long. In addition to that, we think about tetanus. So tetanus is a bacteria that lives in the soil, which means if your horse is out on soil, your horse is potentially going to be exposed to it. The good news is the vaccination is definitely a good way to prevent significant disease. We often think about horses being affected by tetanus after they've had some kind of cut out at pasture in which that bacteria is allowed to enter. the body. In addition to that, we have rabies. So if your horse is outside, your horse can also potentially be exposed to rabid animals such as skunks and opossums. So it's a good vaccination to have. It also comes into play if there's any concern for your horse to have potentially been exposed to a rabid animal. Government officials need to become involved, and it's very helpful if your horse has historically been vaccinated and currently vaccinated. Aside from those diseases, the other things we worry about are the diseases that maybe a horse can transmit from horse to horse. So we think about equine influenza, so that's a horse-to-horse upper respiratory infection. Equine herpes virus, which is also a respiratory infection but can, more scarily, cause things like neurologic disease and potentially abortion. Also strangles. So strangles is caused by the bacteria Streptococcus equi, can cause a nasty upper respiratory infection and sometimes some pretty adverse effects to that as well. From there, it definitely depends on where your horse is in the universe. So if you're closer to the Northeast, you might talk about things like botulism or Potomac horse fever, but here in the Roaring Fork Valley, we don't usually worry about those, so it's not part of our vaccination protocol. So how frequently should you plan on getting a wellness examination or preventative care appointment on your horse? It all depends on your horse. So it might be that we just need to see me annually to kind of do that preventative care appointment, wellness exam, make sure your horse is healthy and checking all the boxes. Or in certain scenarios, it might be that it's twice a year, depending on what we find on those examinations and how your horse is doing in general. So hopefully that helps to clear up any questions you had about equine preventative care and wellness exams. Please let us know if you have any further questions, and if you need to call us here at Roaring Fork Equine, our number is 970-987-4757. Thank you.